Hey everyone! Today, we're diving into a topic that many of us can relate to. Why do we get pimples during our periods? If you've ever wondered why your skin seems to break out just before that time of the month, this video is for you. Let's get into the science behind it. First up, let's talk about hormones. Hormonal fluctuations are the main culprits behind those pesky period pimples. So, what's going on inside our bodies? In the days leading up to your period, your body's levels of androgens, like testosterone, can increase. Androgens stimulate the sebaceous glands in your skin to produce more sebum, which is an oily substance that can clog pores and lead to acne. This process begins in the luteal phase of your menstrual cycle, which occurs after ovulation and before your period starts. During this phase, androgen levels rise. Androgens are hormones that, among other functions, stimulate the sebaceous glands to produce more sebum. Sebum is an oily substance that lubricates the skin. While sebum is necessary for healthy skin, excessive sebum production can lead to clogged pores and acne. The luteal phase typically lasts about 2 weeks and leads to the onset of menstruation. Next, we have progesterone and estrogen. These hormones also play a significant role. After ovulation, progesterone levels rise, causing the skin to swell and pores to close. This can trap sebum and bacteria inside, leading to those annoying pimples. On the flip side, estrogen levels drop right before your period. Estrogen helps control oil production, so when its levels decrease, sebum production can go into overdrive, making your skin more prone to breakouts. Estrogen levels are highest during the first half of the menstrual cycle and help regulate sebum production. When estrogen levels drop, it can lead to increased oiliness and the potential for clogged pores. Progesterone, on the other hand, tends to increase water retention and swelling. This can lead to the swelling of skin tissues, closing off pores, and trapping sebum and bacteria inside. The result? Inflammation and pimples. Now, let's delve deeper into sebum production and inflammation. Excess sebum can mix with dead skin cells and clog your pores. This creates a perfect environment for bacteria, like Propionibacterium acnes, to thrive. Propionibacterium acnes is a bacterium that is normally present on the skin. When pores become clogged with sebum and dead skin cells, it provides an anaerobic environment where P. acnes can proliferate. This bacterium feeds on the sebum and produces inflammatory byproducts, triggering an immune response. The immune system's response to the bacterial overgrowth results in the inflammation, redness, and swelling characteristic of acne. Studies have shown that hormonal changes can also affect the immune system, making it less effective at fighting off these bacteria during certain times of the menstrual cycle. Hormones like cortisol, which increase during stress, can suppress the immune system's ability to combat bacterial growth, exacerbating acne. Furthermore, during the luteal phase, the skin's barrier function can be compromised due to hormonal fluctuations, leading to increased transepidermal water loss, TWL, and making the skin more susceptible to irritation and infection. Let's look at some scientific studies. Research published in the Journal of Clinical and Aesthetic Dermatology highlighted that 63% of women experience premenstrual acne, primarily due to hormonal changes. Another study in the Journal of the American Academy of Dermatology found that high progesterone levels increase skin swelling and sensitivity, contributing to acne formation. This study found that the skin becomes more permeable to irritants during the luteal phase, leading to increased sensitivity and a higher likelihood of acne development. Research also indicates that women who are prone to premenstrual acne have higher levels of inflammation markers in their blood, suggesting a link between hormonal changes, immune response, and acne severity. Elevated levels of cytokines, such as interleukins and tumor necrosis factor alpha, TNF-alpha, have been observed in women with premenstrual acne, indicating a heightened inflammatory state. These studies underscore the importance of understanding how our body's internal processes affect our skin. It's not just about what we put on our skin, but also what's happening inside our bodies. So, how can we manage period pimples? Here are a few scientifically backed tips. Topical retinoids. These normalize skin cell turnover and prevent clogged pores. They also have anti-inflammatory properties. Retinoids, derived from vitamin A, help increase cell turnover, which prevents the formation of clogged pores. They also have anti-inflammatory effects, reducing the redness and swelling associated with acne. Retinoids work by promoting the shedding of old skin cells and preventing the formation of microcomedones, which are the precursors to acne lesions. Hormonal therapies. Oral contraceptives and anti-androgens can regulate hormone levels, reducing sebum production. Oral contraceptives, which contain estrogen and progesterone, can help balance hormone levels throughout the menstrual cycle, reducing the hormonal fluctuations that lead to acne. They work by suppressing the production of androgens, thereby decreasing sebum production. Anti-androgens, such as spironolactone, block the effects of androgens on the sebaceous glands, further reducing sebum production and subsequent acne. Anti-androgens, such as spironolactone, can block the effects of androgens on the sebaceous glands, reducing sebum production and subsequent acne. Spironolactone is particularly effective in women with hormonally driven acne, as it inhibits androgen receptors and reduces androgen production. Anti-inflammatory treatments. Products like benzoyl peroxide and salicylic acid can reduce bacteria and inflammation, keeping your skin clear. Benzoyl peroxide works by killing bacteria that cause acne, while salicylic acid helps unclog pores by exfoliating the skin and removing dead skin cells. Salicylic acid is a beta-hydroxy acid that penetrates into the pores and helps to break down the buildup of dead skin cells and sebum, preventing clogging. Diet and lifestyle. Eating a balanced diet, staying hydrated, and managing stress can also play a role in reducing period pimples. Foods rich in antioxidants and omega-3 fatty acids can help reduce inflammation. Studies have shown that a diet high in refined sugars and dairy products can exacerbate acne. Consider incorporating more fruits, vegetables, and whole grains into your diet to support overall skin health. Omega-3 fatty acids, found in foods like fish and flax seeds, have anti-inflammatory properties that can help reduce the severity of acne. Skincare routine. Maintaining a consistent skincare routine with gentle, non-comedogenic products can help manage acne. Avoid overwashing or using harsh scrubs, as these can irritate the skin and worsen breakouts. Using products with ingredients like niacinamide, which has anti-inflammatory and oil-regulating properties, can also be beneficial. Niacinamide, also known as vitamin B3, helps reduce sebum production, improve the skin barrier, and decrease inflammation. Regularly moisturizing can help maintain the skin's barrier function, preventing excessive dryness and irritation. Professional treatments. If over-the-counter products aren't effective, consider professional treatments like chemical peels, laser therapy, or extractions performed by a dermatologist. Sleep and stress management. Adequate sleep and stress management are crucial for overall skin health. High stress levels can increase the production of hormones like cortisol, which can worsen acne. Cortisol is a stress hormone that can increase sebum production and inflammation, making acne worse. Remember, everyone's skin is different, and what works for one person might not work for another. If you're struggling with severe acne, it's always a good idea to consult a dermatologist. They can provide personalized advice and treatment options. In addition to medical treatments, a dermatologist can help you identify any underlying conditions or lifestyle factors that might be contributing to your acne. And don't forget, consistency is key. Sticking to a skincare routine and making healthy lifestyle choices consistently will yield the best results over time. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe to Health Insights for more health and wellness tips. Let us know in the comments how you manage your period pimples. See you next time.